the request to the broken party.
Hello and welcome to the Fitz and Healthy podcast. I am your host, Dr. Lauren Fitz, and today I have an extra special guest for you guys. So this chick, she and I went to medical school together. I've known her since 2001. It's crazy. Now, we haven't seen each other since we left San Antonio, but this girl I have known since 2001. We were in the same medical school class, and we both have a very common passion, helping people get healthier and happier. So I would like to welcome to the show, Dr. Monica Torres. What's up, girl?
Hi.
How you doing?
I'm doing great.
This is where you're supposed to say, "Hey, girl, hey."
Hey, girl, hey. Just
so,
you, Lauren.
There you go. the people that listen, because that's usually when I interview people, I usually don't have Cinthanie on board. Every now and then I do, but Cinthany's my co-host, and that's always her, "Hey, girl, hey." So literally, when people message us, they always start off with, "Hey, girl, hey."
I love it.
I know, right?
Love it.
So let's start off by telling everyone kind of who you are and what your history is, because how you got to where you are right now is a little atypical for the standard MD. So go ahead and kind of let them know who you are.
Well, I started practicing medicine in 2011. My specialty is pain medicine, interventional spine, and I also have a background in sports medicine. I'm also board certified in bariatric medicine. So that is what sets me apart from my colleagues. I felt that there was a need to address the elephant in the room. A lot of my patients have back pain, knee pain, hip pain, severe osteoarthritis, and a lot of my colleagues, such as the surgeons, would refer patients to me to help them manage their pain after surgery. Or they're not a surgical candidate, and I need to manage their pain with opiate medication, which I hate doing.
Amen.
And it's just this vicious cycle. So I felt that there was a need to address obesity, because a lot of these patients, believe it or not, once I have them lose weight, they often don't need the knee replacement. They don't need the hip replacement, and they feel better than ever. And that's what sparked my interest.
Isn't it crazy though? But it's kind of funny though, because the referral that initially happens can potentially make the surgeon lose business.
It can, but ironically enough, Lauren, I have ortho surgeons that actually refer specifically for weight loss.
Nice.
So they can operate.
Absolutely.
And I was just thinking about this the other day. So they use BMI as a scale to determine if they're a surgical candidate or not, based on and other comorbidities or other medical problems.
Right.
So if they have a BMI greater than 40 or higher, they're not going to operate, because after surgery, it takes intensive rehab.
Absolutely.
To get back to their regular lifestyle.
Right.
So if they don't lose the weight, if they're not active to begin with, they're not going to have a great prognosis, or they're not going to have a great recovery. So surgeons actually refer patients to me so they can lose the weight, so they can have the surgery. And I always tell my patients, come back after surgery, because it doesn't end there.
Absolutely. Absolutely. So for the listeners who aren't familiar with the whole pathway, you went to medical school, you did a residency in rehab medicine, right?
Yes.
And so that was 3 or 4 years.
That was 4 years.
That was 4 years. And then you do an additional year of training for pain medicine, correct?
That's right.
And then you did an additional year for sports medicine?
Actually, no, it was sports medicine and interventional spine.
Okay. Okay. Excellent. Excellent. So you guys, she's had a lot of training. she has a lot of education under her belt. And so this is something that the elephant in the room, like you said, this is something that so many people that are in the OR kindly ignore, because the fact is that we take care of patients in the OR on a regular basis that should have been referred to someone like you years ago. Right.
That's right.
Let's talk about the comorbidities that come along with just obesity in general. What are some of the worst things that you see? Yeah.
There are so many. So hypertension, diabetes, COPD, CHF, obstructive sleep apnea, I know I'm saying a lot of medical terms.
Yeah. That's okay. That's okay. And
we're talking.
Yeah. So CHF is congestive heart failure for those of you that are listening. And these are all basically long-term diseases that will make your state of life terrible if you don't get them under control, if not reverse them. So that's for the layperson that's listening. Because we doctors, we can speak medical speak all the time. I always have to remind myself, like, oh yeah, that people don't know what HTN is, hypertension.
Yes.
High blood pressure. Okay.
Right. Yes.
So okay, in your clinic, so you mostly see patients that have a BMI of what and over?
45. I've seen 55. It's quite heartbreaking.
Oh, man.
And of course, they're not all overweight. I mean, I deal with patients who are, healthy,
Absolutely.
active, and then I see patients who are not. And so I treat everyone the same. We all talk about health and fitness because that's part of my life. That's my passion. And I feel that, again, that's something we should all talk about with all of our patients.
Yes, so true. I think I told you this when we talked on the phone when we connected a few months ago that I used to do anesthesia in a pain clinic.
Right.
And I loved the guy that I worked with, but he almost never. Now, granted, I was not in the clinical setting with him. I was only in the procedure room setting with him. But very rarely did I ever hear a discussion of lifestyle and health and fitness, because so many pain patients in general, I definitely believe can be helped, if not completely reverse their disease process.
Absolutely.
By addressing this elephant in the room, right?
Absolutely. And I've seen it. I've seen it in practice.
So tell us a few success stories that you've seen. I mean, you see them on a regular basis. Tell us some of your favorites.
I do. So I had this one patient who required a hip replacement, and his background was a little unique because he had a history of methamphetamine abuse.
Okay.
So as you know, I work in a pain clinic. So I see patients who have been addicted to opiates in the past or are currently dealing with addiction or have no addiction at all, but they need these opiates to help them function. So I see a range of patients. So this one patient, admitted to opiate addiction in the past, methamphetamine abuse, and he was motivated to get this surgery so he could be functional and get back to working again. And he was probably my most difficult in the beginning because I did not think he was actually going to follow my instructions. I figured he wouldn't listen to me. He was kind of, when I would tell him the things he could not eat, he would look at me like I was crazy. So he's Italian. He's Italian. He loves his carbs. He loves pasta. He's like, what? I can't have pasta. I can't have my lasagna. What about meatballs? Can I have meatballs? Like, he was just going on and on about the things he can or can't eat. And I thought, wow, this guy's probably not going to do so well. But I encouraged him. I told him, I want to see you in 1 week after the initial consultation, and we'll go from there.
Nice.
So lo and behold, the first week he did awesome.
Nice.
He did excellent. He's like, I want this surgery. I want to get this done. So he lost 9 pounds in the first week, which I know is incredible. He was absolutely determined.
Nice.
He did fall off the wagon a few times, but ultimately, and he drove 45 minutes from his home to see me. And that in itself was a compliment. And
that speaks volumes.
To me. So after the first month, I kind of wean my patients off. So I say, okay, let's see each other in 2 weeks, 2 to 3 weeks, and then once a month. So by the third month, he had reached his goal. He was going to have the surgery, and he still had like a month before the surgical date.
Okay.
So I said, you're doing great. You know what you need to do. See me after the surgery. Okay. Well, 2 weeks later, he drives to see me, and he said, I had to see you for encouragement. You're my biggest cheerleader. You're my biggest fan. You've helped me so much. And he started crying, and it was just, he's like, I can't wait to go back to work. And he got his life back together, and he did it on his own. I helped and I supported him, but he did it on his own. And so that to me was my biggest success story, because he had so many things against him in the beginning.
So a few take home points. So this it's actually being recorded on Thanksgiving, which, by the way, thank you for taking the time to record this, because I wanted this episode to come out on Monday, November 27th for a few reasons. One is because people that follow me online know that is day one of this really important test group that I am doing called the High Fat, Low Carb Intermittent Fasting Beta Test Group. And we are doing it 12 weeks. We are starting Monday, the 27th. So it's the Monday after Thanksgiving. You're going to be in the group lurking and kind of overseeing, along with, of course, I'm in there as a coach, but of course I'm an MD. I've got a PhD in nutrition that's going to be lurking in the group and kind of helping. I have a chiropractor that's also a functional medicine doctor. So the point of this is that this journey is not easy. If it were easy, we wouldn't have the epidemic of obesity that we see in our country, not just in our country, but taking over the world, honestly. You see obesity in countries that you used to never see obesity in. And it is directly related to the foods that we are eating and the standard American diet. And so if it's not easy, then what's the answer? Well, you have two options, right? You have the option to keep doing what you're doing and live a miserable existence, because there's no one that can argue that if you are living with excess weight and diseases, you are not living life to the fullest, bottom line. And I'm not saying that you can't be happy if you're overweight, but you're not living to your fullest potential if your weight and your health and diseases are holding you back, right? So you can either do that option, which is not the one I recommend, or you can seek out help. And this is where a support system like this beta test group, or like your clinic, like your doctor-patient relationship, is crucial. And, one thing that we're doing different in this beta test group is that not only because, I tell everyone, look, you can go to Pinterest and download any high fat, low carb menu and do that, right? I'm not going to give you anything that you can't find on your own for free by going to the library or searching Google, right? But the fact is that the community and the support and the giving you the tools to be able to do this with the community and support is everything. It's going to be the game changer. But on top of that, learning how to realize that it's not just about vanity and how I'm going to look in my swimsuit, because a lot of people that are in this group, they haven't thought about wearing a swimsuit in years, decades, maybe their entire life. And that's the last of their concerns, but they still want to look better and feel better. But ultimately, it's about their health. And so everyone in this group is required to get labs before. And I love it because everyone's required to get labs within the 7 days before starting, just so that we can show people that not only are they going to lose weight and feel awesome, lots of inches in weight, but they're going to heal themselves from the inside out. And so we're going to prove that high fat, low carb, moderate protein lifestyle using whole foods, not processed foods, not fake foods, but whole foods, can not only lead to a better cholesterol profile, but your hemoglobin A1C, your fasting glucose, your body's response to insulin will heal itself and get better. And so super stoked about that. I don't know if you've been watching any of my live videos on the details of the group, but
I have.
but I'm really excited that you're going to be in the group, and whatever participation that you have in your expertise is definitely going to help, because I definitely have the mindset that the more people that really give a crap, the better. And you and I are definitely like-minded when it comes to that.
Yes. And I was going to say that high fat, low carb way of eating is the best. And this has been proven on head-to-head studies with all the other diets. And I hate the word diet.
I know.
All the other diets that have been implemented. So we're talking Mediterranean, South Beach, Atkins, DASH, we're talking Jenny Craig, Weight Watchers. The best long-term outcome is with the high fat, low carb, and the added bonus, it doesn't affect your metabolism. So a lot of people get through this plateau. They hit this plateau and they're wondering, why am I not losing any more weight? I'm working just as hard. Well, your basal metabolic rate that sets your metabolism is lower. So now you have to eat less to either maintain or continue to lose weight. And that's just no way to live. Absolutely not.
Amen. Food is to be enjoyed.
Food is awesome. And, you know, when I see my patients, I put them on a plan. I ask them, how do you feel? It's not about the number on the scale.
Nope.
In fact, I hate scales. I haven't been on a scale in years.
Amen. Amen.
Because just so you know, on a side note, the reason why I don't use scales is because it's a number that doesn't show all the information. It doesn't tell you your muscle mass. It doesn't show your body fat percentage. So a lot of people pay more attention to that number than how they feel or how they look. And so they get discouraged. Oh, this isn't working because the number isn't moving.
Right.
Well, maybe you've lost body fat, but you've added muscle, and muscle weighs more. And guess what? We all want muscle because it burns more fat, burns more calories at rest. You don't even have to do anything. So it's kind of great.
Okay. So let's say, walk me through the standard. Let's say that I come to you and my BMI is 35, 40. And I come to you because I'm referred by my surgeon because I want to have whatever. What's the first step that you take me through in your clinic?
Well, so I first ask you why you're here.
Okay.
I want to know what your motivation is. Did the surgeon refer you and you're just here because you're following instructions? Or are you actually motivated and you're actually interested to find out what I can do for you? Second is I want to know about your diet history. We all have one.
Yes.
On multiple diets before.
Roller coaster.
Yes.
Yep.
So I want to know, what have you tried and why didn't it work or why you didn't like it? And more often than not, they do really well in the beginning of any diet. And then there's a trigger, an event that sparks emotional eating, and they fall off the wagon, or they got discouraged because they're not losing any more weight. So I have all of my patients, every single one, before I get them started on any meal plan, is to read the book Intuitive Eating.
Ooh.
Because it talks about the psychological component of how they got where they are today.
I need to write that down. Intuitive eating. We will put that in the show notes.
I'm telling you, Lauren, it will change everybody's life.
Really?
So my sister read it. She had been on a diet roller coaster her whole life. And it broke my heart because I know she worked so hard.
Yes.
And she wasn't seeing any results. So she actually, there's an audio version. I
was about to ask you that. Praise Jesus.
Yes,
I'm so glad. I don't read. I fall asleep. So I listen.
And I'm a busy woman.
Yes.
And so on my way to work, I'll listen to a book. On my way home while I'm cleaning. So yes, I totally.
Awesome.
Yes, audiobook is the way to go.
You know, and it's funny you say that because just this morning in the group, which I haven't added you to, by the way, so remind me to do that. But in the group, I did a little video, shocking, right? Telling them that one idea that we had was that we are going to recommend a book every week during this 12-week adventure.
Oh.
Some books will be nutrition based, some will be mindset. And it sounds like this is probably going to be a little bit of both because as you know, mindset, I think, is the number one.
If you don't fix the psychological component, anything I do or you do will not work.
Did y'all hear that? Say that again, Monica. Say that again. People need to hear this.
If you don't address the psychological component of how you got to where you are today, then you are not going to have any long-term success, or you're not going to have any change. It will always be temporary.
Yep.
It will not stick. You need to change what's up here. And again, start loving yourself, because you treat your body how you feel you should be treated.
Yes.
So if you don't like yourself, you're going to eat things that are going to make you feel bad. Pizza, hamburgers.
Yes.
It'll give you that temporary high because you release endorphins. But then afterwards, you deal with the guilt, the shame. And that is the one thing I don't ever want my patients to feel is guilt or shame.
No.
Because then it's now a roller coaster where they feel bad. They're like, oh, well, I fell off the wagon anyway. Might as well just mess up my whole day and eat whatever I want. And then the next day they're like, oh, I'm going to start over again. But then guess what? They're going to reach for that donut, and they're going to reach for the things that are unhealthy because they feel that guilt and shame. And they just, and so again, it's a vicious cycle.
It is. In fact, I had one person who literally messaged me yesterday and has already quit and took herself out of the group. And I could just hear in her verbiage. Hers is all mindset, and I told her, I'm like, this breaks my heart because it's not about disappointing me. It's about you realizing that until you figure out what's going on up here and how to conquer that, you're going to stay on this vicious cycle that will ultimately kill you.
Absolutely.
And people don't understand that that is the root. And that's why, like, one of my favorite things is when people ask me, well, and they almost speak in like they're ashamed. Well, I've had gastric bypass. Is this something for me? And the fact is, I think, as you know, you've seen a lot of people that you initially lose weight in gastric bypass, but a large majority of people end up in the long term gaining it back because they don't address the root issue, but they feel shameful about it because they feel like they failed. That I've even had gastric bypass and I can't get this under control. But the fact is that root cause is all from what's going on up there.
And I want to address one more thing because you brought up an interesting point about gastric bypass. They put you on a diet before they do the surgery. They put you on a low carb diet.
Did y'all hear that?
Everyone is going to have to do this diet if they're going to do a gastric bypass. And guess what? What is the maintenance after gastric bypass? Low carb diet. So you're going to be on this anyway, whether you get the surgery or not. And guess what? You can still gain the weight back after the surgery.
Yep.
So I feel that there's a role for gastric bypass for some people, but it's not a quick fix and it's not the answer.
Yep. Yeah. No. And in fact, I feel like there's a very, very, very small proportion of people that it is appropriate for. Yes. And, I know that I will get some people, giving me hate mail saying, well, I wouldn't be alive if it weren't for, and that's awesome. I'm happy for you. But the fact is that if I can get to a person before they make that decision to alter the way God made you, your internal plumbing, the way it was perfectly designed, let me teach you how to treat your body so that you don't have to cut it open and redesign the plumbing, if you will.
Right. And there are complications after gastric bypass. You have to think about the vitamin deficiencies that you might have.
Lifelong.
Malabsorption syndromes where your body doesn't absorb the nutrients in the food that you eat.
Throwing up the rest of your life.
Yes. Yes. Absolutely.
Throwing up is like my least favorite thing to do in the world. I don't understand. And obviously it's a disorder that a lot of people face, bulimia. I don't understand how anyone can get to that though, because vomiting is my least favorite thing to do in the world. And, I have a few people close to me that are post-gastric bypass, and literally they can eat just literally like a tablespoon more than they usually do, and will have to throw up because it has, and I mean that they'll have to face that their entire life. Exactly.
So it comes with a cost, with a price. And so you have to make that decision for yourself. So again, back to intuitive eating, it retrains your mind to stop when you're full, eat when you're hungry. And if you don't want to eat something, don't eat it.
Right.
If you don't want to finish your plate, don't finish your plate. We have this idea that if it's put in front of us and we don't want to be wasteful, that we want to finish our plate. Yeah. And we don't want to, be rude to the chef by not asking for seconds. Right. I know I grew up in a Hispanic family. Yep. I'm Hispanic. If I did not compliment my mom 10 times, it wasn't good enough. And if I didn't have seconds, then it wasn't good. I didn't like it.
Right.
I loved it. And I told her I loved it. Because I didn't have seconds.
Yep.
It wasn't good enough. Well, I told my mom to get over it. I love it. I love it dearly. And guess what? Last year, now this is probably my favorite success story.
Yeah.
Last year, my mom came to visit me. I live in Arizona. She lives in Texas. And it was during the holidays, the toughest time of the year to start any change.
Absolutely.
Lifestyle change, especially eating.
Yes.
So my mom has diabetes, high blood pressure, obesity, and she was ready for the change. Now, this is a conversation I had for years.
Right, of course.
Started medical school.
Yes.
But she came to me and asked me, what are you doing? How do you stay so thin? So I told her, I educated her, and she said, you know what? I want to start tomorrow.
That gives me chills.
I cooked for her. I planned the meals for her. We wrote down exactly what she was eating. She had a food diary, and she stuck with it through okay, we're talking November 1st, she started. So it was Thanksgiving.
Thanksgiving and Christmas.
Yes, we had a modified Thanksgiving dinner.
Awesome.
So it was low carb.
Right.
And I made it so it was tasty for her as well. So it can be good, guys.
Of course. Yeah, that's a misconception. Yeah, that's a misconception. Yeah.
And Christmas, New Year's. So she lost 30 pounds.
Holy crap.
She her diabetic medication had been changed. So it has improved. It's now in the normal range where it was out of control. She does not have to be on insulin. And that was pretty much what was the trigger too. The doctor told her, if you do not get it under control, you will start insulin injections. That scared her.
Should.
Absolutely.
That sometimes people need that fear to be, lit under their tail end so that they can actually do something. And the idea of injecting insulin sometimes is what takes it for a lot of people.
Absolutely. So I'm proud to say 1 year later, she's still the same and she's doing great.
Shout out to Mama Torres.
I love her. I think that if anybody can do it, if my mom can stick to it, and she's Mexican, she loves the tortillas. She loves Mexican food. We all do.
Of course. And
it was hard for her. Because there was a lot of old patterns that she had.
Yes, absolutely. Well, there's two take-home points that I want the listeners to take home from that story. Is one, we all have our different excuses in our brain. Well, I'm Mexican and I can't do it. Or, I'm raised in the South with, chicken waffles or whatever. Like, we understand we don't want people to lose their culture, but you can take your cultural food and make it where it is healthy for you.
Yes.
You don't have to suffer because food is meant to be enjoyed. And if you just alter your way of thinking about food, realizing that, okay, I can actually make it taste really good. Yes, it will take a little bit of work because it's not your traditional methods that you've been, eating. How many breakfast tacos did we have in San Antonio? Like, it was
impossible not to have them.
I know, right? but viewing like Robert, his wife is Filipino and makes just amazing food and realizing that you can still have amazing food, but we just need to alter the way in which we prepare it, the ingredients that go into it. And there's great substitutes for, like if you are cutting out grains and gluten, there's great substitutes. So you can, substitute in and still have that same taste that makes you enjoy food, but you don't feel like you're suffering or losing out. Right. And then the other point that I wanted to make is that, there's 3 points I want to make. The fact is your mom and my mom have a very similar story. A lot of people that are in our mom's age bracket think that it's just, they've gone past that stage of life and their metabolism is slow and they can't lose weight. Right. And, that's wrong. Yes. That's wrong. You are never too old or never, at a stage in life where you can't make changes. And then the third point that I want to make is that, you can bring a horse to water, but you can't make them drink. They will decide when they are thirsty enough to drink. And, that's the biggest question I get from coaches that are on my team and clients that have lost weight because you desperately want your loved ones to be healthy, right?
Yes.
But you ultimately, at the end of the day, the only thing that you can control is your thoughts, your words and your actions, right? And you can't control anyone else. So the best thing to do is live by example. And you lived by example for 30 plus years. And finally your mom came around and said, okay, I'm ready to drink. And so if you have a loved one that's suffering from any of the multiple comorbidities that we talked about that come along with obesity, my best advice, I assume both of our advice is to give you guys is to just live by example and become the best you. And it doesn't happen overnight. It's not easy, but finding people like Monica, like myself, like-minded people that don't want to just shove, here's the latest weight loss drug, go to CVS and fill the prescription. Like it's not, a quick fix is just that. It will help you temporarily lose weight, but the repercussions are going to be way worse in the long run. And it's a lifestyle change. And that's why, ultimately this 12-week beta group that we are doing is going to change the lives of not just the 500 plus people that are in the group, but it's going to change the lives of their family, their friends, and beyond.
Absolutely. Absolutely.
So super, super excited. Okay. So then tell me about your input as far as food and educating the person, because, a lot of people that listen to the Fitz and Healthy podcast, they listen to my live broadcast. So they kind of have a generic understanding of what I personally, in my own experience, have come to advise people to eat. But let's go back to me being a new patient, and I've told you why I'm here, and so I'm here because I need help, Dr. Torres, to lose weight, because my midsection is not looking great. So help me out. It's not because my surgeon said, it's because I want help. So what's the next step?
So I talk about low carb, high fat eating. I don't like the word diet.
Yeah, I know. I saw you.
There's the word die on it.
I saw you pause. You're like, nutrition. Yeah, I like that word.
Yeah, it's a new lifestyle. So I talk about how it's going to be difficult. You may not like it in the beginning because your body is going through a detoxification process. Imagine all the processed food and all the sugars. It causes cravings.
Yep.
And when you eliminate that from your way of eating, and you introduce whole foods, vegetables, lean protein, and your body will then start craving it. So you're not going to feel good. You're going to have headaches. You're going to feel dizzy. You're going to feel not yourself. So I have things that they can do to make themselves so they can feel better.
Right.
Hydration is key. Make sure that you stay hydrated, because if you don't, again, you're going to feel hungrier in the end. Yes. Imagine a lot of times I feel hungry. It's because I'm dehydrated. Absolutely. And I need to drink some water. Then I drink water and I feel fine. So your body's telling you, they're sending you messages throughout the day. It's determining what message is your body sending you. Do you need to drink water, or do you need to eat? You need to make that decision for yourself. So I talk about the meal plan. I give them a list of foods to choose from. So a list of lean protein, a list of vegetables. For the first week, I have them avoid fruit and, of course, all carbohydrates. So we're talking no processed carbohydrates. So no wheat. They can have dairy. Now, I'm not a big fan of dairy. I've become more vegan because I feel better. And dairy is it promotes inflammation.
Absolutely.
And so I have them eliminate, if they can, dairy. If not, then they can have that. So the first week is pretty limited. The second week, we start talking about exercise and adding fruit into their diet. So they have a little that, because I know a lot of them have a sweet tooth. So we add fruit and we talk about how to structure your meals. So they're given a list, and I tell them how to structure their breakfast, their lunch, and their dinner. One thing I want to mention is I am a huge fan of intermittent fasting.
I was just about to ask you.
I am an intermittent faster. I don't want to implement intermittent fasting in the beginning because I want to introduce change slowly. Imagine if I tell them, okay, now you're intermittent fasting and you're eliminating all these foods, they're going to walk out and not come back.
You're going to blow their mind.
Yes. So I just want to eliminate one change at a time. So, after a couple of weeks where they feel comfortable, then I introduce intermittent fasting. And I love intermittent fasting. I mean, I feel great on it, and so do they. And it's just amazing to see results. Within 2-3 weeks, people have more energy than they've ever had before. They don't have sugar cravings like they had before. And a lot of it, again, is that process. In the beginning, your body's gonna fight it, but don't listen. If you get through 3-4 days, I promise you're not even going to want sugar after that.
Absolutely. So we, in the beta group, we are doing a intermittent fasting window option of either 6-hour eating window, 8-hour eating window, or 12-hour or 10-hour eating window. So essentially a person is going to commit to whatever eating window they want and stick to that for all 12 weeks. We are actually doing no dairy as well. I love, and I wish that I would have coined this phrase, but I got it from a book that I read, talking about, don't say that this is hard. Birthing a baby is hard. Getting a diagnosis of cancer is hard. Losing a loved one is hard. But eliminating certain food groups for a small window of time, because 12 weeks is nothing. I mean, I've been on earth for almost 38 years. 12 weeks is nothing. But in this group, I actually posted just last night because I realized that someone asked me about diet soda, and I know, and and I know that you and I probably feel the exact same way about soda and diet soda.
I have a funny story about that, but
oh, sweet! I can't wait to hear it. So I reminded them that during this 12-week beta test group that they've committed 110% to following, that they will not be partaking in soda or diet soda or alcohol. And so I asked all of the soda addicts or sodaholics to commit or comment in the comments below, and it's crazy how many people are addicted to soda.
What I wanted to tell you was I work with a colleague of mine that I didn't know he drank soda, but I saw a big old Coke, not even Diet Coke, so Coke, sitting on the counter. And I thought a patient had left it behind. And one of the medical assistants said, oh no, that's Dr. So-and-so, that it belongs to him. And I'm like, what? So I wrote in a Post-it note. I said, I love you dearly. But I pour Coke on my battery, my car battery, when it doesn't work. Imagine what it's doing in your system. When I think of that, I don't want to put that in my body. No. I mean, seriously. I mean, it's toxic. It's poison. It's not, again, if it's not promoting health, why would I want it in my body?
Absolutely. There's no gray zone. I always say that food is either good for you or bad for you. And that's drink as well. And,
yes.
And and I definitely, I am of the camp. I'm not a huge fan of alcohol for multiple reasons. Anyone that has listened to any of my podcasts know why. That doesn't mean that I never partake in it. I can count on one hand how many drinks I've had in the last year. But that being said, it doesn't make me better. I know that. Right. And soda, diet soda and regular soda, definitely, I call them liquid diabetes.
Yes. And on the comment on, I wanted to comment on alcohol. It can slow up the metabolism up to 75%.
Oh, can you say that again, girl? Say that again.
Alcohol can slow your metabolism up to 75%.
75%, guys. Come on. Is that really worth it for that little buzz that you feel for like a few minutes? I mean, it's just, yes. I don't understand it.
So I read an article from the Washington Post that was talking about intermittent fasting, but in a negative light, indicating that people who skipped breakfast, okay, that right there should give you a big clue.
Yep. Big food companies.
yes, that they had a higher percentage of body fat, and they actually gained weight after 12 weeks of intermittent fasting. And of course, through that, again, I knew that it wasn't substantiated. And again, it's all about the food industry. I eat breakfast, but for dinner.
Exactly. And that's like my favorite dinner food too, right?
I love it. It's like
eggs, bacon, and avocado, baby.
Love it. I'm not going to take that out of my diet. I'm just going to switch it to a different time.
Exactly. And the food company benefits from the general public believing that you're supposed to eat every 3 hours and 6 to 7 meals a day. And they have done a great job at convincing everyone. So when people like us come along and are like, wait, actually, you can actually survive literally on little as 1 meal a day. And it's our bodies were perfectly designed like that because we haven't always had access to grocery stores.
That's true.
We were designed for feast and famine. For millions of years, human beings have hunted and gathered. And there have been times that there is no food to eat. And that's why we have adipose tissue as our backup storage fat and our energy. And it's just, this is one of the main reasons that we are doing this beta test group, to show people that this is not just a fad diet, because, the whole high fat, low carb, ketogenic and intermittent fasting, I think a lot of people think it's a fad, right? And in reality, we're not going to have good medical research because it costs too much and there's no one to benefit from it, i.e. big pharma and big food companies. So for us to have a legitimate, like the Women's Health Initiative, I mean, how many millions of dollars did that I mean, completely waste to basically disprove what they were trying to prove.
Right.
Right.
Exactly. Perfect example.
Yeah. So that particular article is just one of many that are examples of the media is paid by lobbyists, by government, by big food, by big pharma. Another article that I think about is the one about fat and fat being bad for you. The one that completely went, was it in USA Today or?
I know Time has posted so many. One year it's eggs are bad for you. And then a couple years later, eggs are good for you. So, I mean, just that in itself contradiction. There is no, there's no loyalty.
To
the people. To the people.
And at the end of the day, this is why I always am preaching that the healthcare system doesn't care about you being healthy. And for you to be healthy, you have to take your health into your own hands and do something about it and truly find healthcare providers like yourself, like myself, like the nutritionist that's going to be helping, like the chiropractor that's going to be helping, who really want to empower the individual so that you don't have to be on prescription medicine your whole life, so that you don't have to have that knee replacement surgery because you've been overweight for most of your life and you have no cartilage. Guess what? We can try and reverse some of that damage. And I mean, just the simple fact of losing weight so that you don't have so much impact on the joints that were not meant to have that kind of weight can relieve a lot of pain. So, I mean,
and I want to say that the surgeons that I work with and the specialists that I refer to, we all feel the same. So it's a win when he doesn't have to operate on someone.
Awesome.
And that's who I like to align myself with.
Absolutely.
I'm not going to refer a patient to a surgeon who operates on everyone.
Yeah.
And we all know, like working in the medical field, we know which surgeons operate to operate and the others that will turn patients away. But
so true.
I want to make a comment, and I've seen this in my practice. If a patient is told no by one person, by a surgeon, they'll go and get a second opinion. And that second opinion will say no. And they'll get a third opinion. And that third opinion will say, yes, you need surgery. And then they'll feel satisfied and they'll go through with the surgery. Because in their mind, as a patient, they wanted surgery all along.
Absolutely.
Even though 2 out of 3 surgeons said no. And that, I just want you to listen. Just listen to your physicians and ask a lot of questions. But if there's a reason why 2 out of 3 surgeons say no, you've got to listen to them and try to understand why.
So true. And that's part of our gold team that's running this group is to educate because, we are eliminating fruit for our meal plan because it is low carb. And we're going to explain to them the impact on their leptin and their impact because most people in this group have a sugar addiction. And just like a cocaine addict, you wouldn't give them just a little bit of cocaine. You wouldn't give an alcoholic just a sip of alcohol. And a lot of the people that are in this group are addicted to sugar. And a lot of people will abuse stuff like fruit. And I'm not saying that fruit is bad, but fruit is seasonal and it was never meant to gorge yourself on. I see people that are food addicts go from one addiction to the next. And so we're trying to break that cycle.
It's interesting you say that because, for the first week that I have my patients without fruit, they look at me stunned and they're frightened and they're thinking, great, no fruit. I would prefer that they have no fruit at all.
Yeah.
But I'm trying to compromise with them and thinking, okay, one week without fruit. And if you really want it, you can have it the second, the third week.
Absolutely.
But again, I agree with you. I mean, it does trigger your mind to want more of the same thing.
Absolutely.
More fruit, more sugar.
And the people are now asking, well, is coffee okay and tea okay? And then of course they're asking about creamers and sweeteners and whatnot. And, as far as, because we look at, okay, so let's take aspartame. I mean, that's the obvious, I don't think anyone should be ingesting aspartame at all. Yes, but aspartame is the sweetener, artificial sweetener that's in most diet sodas. It's in so many food packages, if you read the ingredients, it does so many bad things to a person's body. And on the other end of the spectrum, the sweetener that's natural is organic stevia. And I definitely, if you're going to have a sweetener, I would prefer it to be organic stevia. But also, if you have a sugar addiction, I would prefer for it to just not be sweet at all, because we want to break that addiction. You know, so there are going to be some people that can't just go to straight black coffee, which is okay. But I definitely have of the mindset of like, just like I said, you wouldn't give an alcoholic just a sip of alcohol.
That's very true. That's a very good example.
Yeah. Yeah. So okay. So you long-term, do you see patients once you feel like they are good to go? Do you see them monthly or every 6 months or yearly, or?
I tell them that it's an open door policy. They can come in whenever they want. I like that. And I can see them 6 months, a year, 2 years, that my door is always open to them. I would prefer that they see me after they've had the surgery, because I want to implement long-term solutions. I'm not into quick fixes, and it's for a lot of these patients, they think it's temporary. Yeah. That they're only going to eat that way for a short period of time. It is to introduce a new way of living and a new way of eating, but I would prefer that they come see me so we can talk about long-term solutions. Because, I mean, I'm wondering about your test group. I mean, what are you going to tell your clients after the 12-week is over? What are you going to do for them after?
Absolutely. A lot of them. And this is why anytime that I'm talking to a potential new client, I call these online accountability groups magical, because they really are, because they're usually the missing link for most people. Because the reality is, like I said, you can go to Pinterest, you can go to Google, you can go to YouTube and learn anything. I mean, knowledge is free, essentially. But if it were that easy, you wouldn't be talking to me right now. And so we do have a strategy that we will teach people, because there are some people that can reintroduce, a particular food group in a smaller portion, if you will. But there's going to be a lot of people that realize that, like, let's say dairy, they try to reintroduce dairy, and all of a sudden they start to feel bloated and gassy, and they're like, oh, I never realized, but it was dairy, And so basically a reintroduction phase, but it's going to be slow, and it's not going to be all at once. Good. But ultimately the most people stay with me as far as the online groups, because it's the accountability is everything.
Yes. And that is key. I mean, I'm not going to say that I do this all on my own either. Right. I don't think anybody does. No. We all have a team or people that help us, support us, encourage us. So I actually have a Beachbody coach that I work with. He trains me 3 days a week. We talk, we stay in contact, because I need accountability too. Absolutely. I'm not perfect. Nope. Yes, I know what I need to do. I know how to do it, but sometimes you need a little help. You need someone to kind of remind you. And not a lot of I would say a good portion of my friends work out, they eat healthy, but I want to surround myself with like-minded people. That means that if I meet with my trainer 3 days a week to keep me in line, that's what I'll do. And it's priceless.
Absolutely. And isn't it crazy how few people that are in medicine actually take their own health?
Oh my gosh.
Serious. Yes. Isn't it sad?
It is.
But it's not just doctors. I mean, it's doctors, it's nurses, it's med techs.
I think we're the worst at taking care of ourselves.
I know.
And it's something that it's definite. We're used to taking care of other people. Yeah. We're nurturing, but I also believe in heal thyself.
Amen.
If I'm a good reflection of health, and I'm asking someone to be healthy and make changes, they're going to look at me and say, well, what about you? You need to walk the walk. People are going to trust you more. And it also starts a conversation. I have patients that will ask me what I do. How do you stay so thin? I don't even bring up the conversation. I don't even ask about their eating, their way of eating or their lifestyle. They bring it up to me. And then that sparks a conversation. I tell them what I do, and there goes change.
Right. Well, and also it's so rare nowadays to see a physician who actually is healthy and in shape. And so when they come to someone like you, it's kind of like, oh, all right. And, but yeah, no, it's,
but I get a little different. Oh, either one, they were expecting a man.
Oh yeah.
I don't know. Two, they weren't expecting someone so young looking.
Right.
And petite. I'm like,
yes.
I'm just the antithesis of what a doctor should look like, I guess. I don't
Yes.
know.
Yes.
But
don't you love breaking that stereotype? I love breaking that stereotype.
I do. I secretly love it.
I just went to a conference that was basically a business conference, a 5-day. There were like 2,500 plus people from over 71 countries all over the world. And some of the most successful business owners, entrepreneurs. And it's always funny because when I would give them my card, they would turn around and the first thing it says is medical doctor. And they'd look at me and they would look at that. You're a medical doctor? Yes, I am. Thank you very much.
Yes. And you worked hard for it. We both did.
Yes. Yes, for sure. But you and I went to the same med school. It always blows people's mind when I tell them that we got zero nutrition. I mean, I don't remember of course we learned what a protein and fat and carbohydrate is, right? But that's about it.
That's exactly it. And that's why I decided to go back to learn about bariatric medicine, learn about nutrition, because I'm so passionate about it. I want to share it with my patients, but it's true. I had to seek a certification, after med school.
Right. And it's interesting because I bet you most of what you, practice and tell your patients wasn't officially learned in that extra training. because I know what I told all my patients, because I was doing it myself, was, eat a low fat diet and eat less and exercise more. And when you realize that, it's not working on my own freaking body, then maybe all of these patients that you thought were lying to you really weren't lying to you. They were really taking your advice, and it's bad advice.
Absolutely.
Absolutely.
I always go back to weight loss is 80% diet or nutrition.
Yeah. And honestly,
exercise.
I think it's probably more than that. I'm the more I see and more experience and the more I learn, I think it's probably closer to 90 to 95%. Honestly.
I agree. And I don't know if I got this from you or Melissa McAllister, because I actually follow Melissa. She's awesome.
She is.
You can't out-exercise a bad diet.
That was me. Thank you very much. Okay. I will take credit for that.
Thank you, Lauren. I use it all the time.
Thank you. No, but it's true, because I've always loved exercise. When I was 16 years old, I taught aerobics at my, the gym that my dad's still a member of, WRS, shout out Waco, Texas.
Nice.
But I taught step aerobics, I taught high-low, I taught an abs class. I've always loved fitness, and getting to the gym and working out has never been anything that has been hard for me, because I enjoy it. But, that video that really did it for me was the Turn Down for What video, where I saw, like, at that point in my life, I was 34, and I knew I taught on my own 4 killer classes. And that was in addition to killing it at the gym on my own. And my waistline kept growing, and it was just like, what the heck? I don't understand. And that's when I really started learning. And I always tell people, look, everything that I have learned has been on my own after med school, and it's out there for you. And that's another reason why we are going to be giving books to read for, voluntarily, volunteer assignments, to read in the
extra
group.
Credit.
Exactly. Extra credit to
type A.
Yeah.
Extra credit.
Exactly. Yeah. There's a lot of us females in medicine that are type A. I'm just going to say that.
I embrace it.
Yes, exactly. So, Monica, I acknowledge you for your true desire to help people and empower people. Like attracts like, for sure. And we already talked about this on the phone, but it's going to be people like you, like myself, like Melissa, like there's so many other of us that are like-minded. We're definitely the small minority at this point, but it's going to be people like us that make grassroots movements to actually change the health of this nation. Because at the end of the day, it's just like your patients that finally get to the point where they decide I'm worth it and I love myself enough to change, and it's never too late. I don't care how much weight you have to lose, how old you are, what color you are, where you are in the world. Because we have listeners from all over the world, and it's not just for the standard American diet people.
Yes.
So I acknowledge you for your desire to make the world better, to ultimately empower people to become their best, healthiest selves. So tell the listeners where they can find you. Well, I'm on Instagram, Dr. Monica 007. Yes, I love it. And that's DRTORRES 007, correct? DRMONICA 007. Oh, Dr. Monica. Oh yeah, not Dr. Torres, Dr. Monica. Okay. So we're going to say that again. Dr. Monica 007. And then if there is anyone that is in Phoenix, they can find you how? Well, I work for Valley Pain Consultants. Okay. And I'm if they look online for Valley Pain Consultants, Phoenix, Arizona, they'll see a list of our physicians. We're located all over the valley, and I'm in North Scottsdale. Okay, excellent. So she comes highly recommended, guys. So if you are anywhere in the vicinity, and she's definitely worth traveling to Scottsdale for for sure. So we end every podcast. Usually Cinthanie says it, but she's not here today. So I'm going to remind the listener that you are a good person and you deserve good things to happen to you. So thank you guys for spending this time with us. We hope that you had a happy Thanksgiving, and really take this time to love yourself and make a change for life. So see you guys later. Make sure that you find us on social media. You can find Cinthanie on Instagram and Facebook at Cinthanie. So that's CINTHANIE, and on Snapchat at Cinthanie P. And find me on social media platforms like Instagram, Facebook, and Twitter, all at Club Fitz Fitness. Remember, that's FITZ Fitness. And on Snapchat, just at Club Fitz. I appreciate your time listening so much. If you enjoyed this episode of the Fitz and Healthy podcast, can you please go do me a favor and go subscribe at whatever platform that it is that you listen to podcasts. Leave a review. We read every single review, and we appreciate the time that you take to leave your thoughts and opinions. Now, also remember, while I am a medical doctor, the information I provide here is not intended to provide medical advice or a professional diagnosis, opinion, treatment, or services to you or to any other individual. I am providing general information for educational and informational purposes only, and it is not a substitute for medical or professional care. You should not use this information in place of a visit, call, consultation, or the advice of your physician or other healthcare provider. The information I share is not intended to treat, cure, or diagnose any disease or medical condition. If you believe you have a medical emergency, just call 911 immediately or your physician. Now, enough of that medical legal jargon. Thank you so much for listening to this podcast. I appreciate your time. Now, go live a Fitz and healthy life.